In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, everybody? Back at it again. This show is dedicated to Slick Rick. You can find Slick Rick down in my comments. Always giving me nifty things to look up, like this gentleman right here, Dr. Charles Hoffe. Because this is one of the people that Slick Rick recommended that I, look into. And, he always gives me these nifty people, to look into. And, he talks about how they're more credible, than the other people that I reference, or any of my, my other past, I don't know what you call them. What do you call them? Exposés of snake oil salesmen. But we'll start keeping score, Rick. Start keeping score. I think I'm up by about, 4 or 5 by now. So, Abuki 5, Rick 0. I'm about to add to it, Rick. About to add to it. But before I do that, can you guys please like, share, and subscribe to the channel? I appreciate all of my supporters. I appreciate, those who have contributed to the channel to try to, help me keep going with the content and whatnot. Please go ahead and hit the like button. Help me out with the algorithm so that I can get a little bit more exposure. You know how this, the algorithm works. So I appreciate that. Trying to get this information out here to help our community, to help, those who are looking for credible sources and information with regard to our current dilemma, that is COVID. And without further ado, let's get after it. Dr. Charles Hoffe, Slick Rick said, what about the research that Dr. Charles Hoffe has done proving that the COVID vaccinations cause clotting? So I went and I looked at Dr. Charles Hoffe. Didn't take me long for me to find out that Dr. Hoffe has been selling snake oil to the good people of Canada and of the United States. And this can't be allowed. So let's look into Dr. Charles Hoffe. Alrighty. We'll start out with the AFP fact check. Testing by Canadian doctor does not prove that COVID-19 shots cause clots. Okay. A Canadian physician claims in a video clip shared on social media that most people who receive the widely used COVID-19 vaccines will experience blood clots, but experts say his conclusions stem from an analysis that was not published in accordance with the scientific method and was not peer-reviewed, and does not prove the shots are causing clots. So, Dr. Charles Hoffe claims in a video posted on Facebook, of all places, Facebook, not in a reputable journal, not peer-reviewed by other scientists so that they can replicate his findings and further prove his claims, but on Facebook, the notorious website that has been spreading false information, has caused the riots at the Capitol and whatnot. People riding around in caravans thinking that they're saving children from mask wearing and getting vaccinations. People who have been exposed to knowledge through their cell phones but can't disseminate factual information from, or differentiate from factual information from snake oil. You can give a person, an equation, but if they don't know how to do equations, they have a handful of knowledge that they cannot use. We have to keep that in mind. And we have to take into consideration the effects of these platforms in spreading information quickly that can't be proven. They're just stories. All right? We have to keep that in mind. But let's get on with the article, because I know you guys are itching to find out what's going on, like I did. So let's move on. All right, so Dr. Charles Hoffe, in a video posted on Facebook on July 7th, 2021, said that spike proteins elicited by the COVID-19 vaccines using messenger RNA technology will cause microscopic and scattered blood clots that permanently damage tissues. Okay. Dr. Hoffe claims the clots are too small to show up on scans, but that he has identified them using blood tests for a substance called D-dimer, which are used to find evidence of clots. Yeah, we do D-dimer tests. We also do other clotting tests where you can basically make a small puncture on the arm, place it on the card to show whether the effects of antithrombolytics are effective, or if they need to be adjusted. Doing this for a long time. It's not a complex process, but let's move along here. All right, there's the notorious Dr. Charles Hoffe. Okay, so the video, which has been watched more than 110,000 times and also appeared on Facebook here, and here, links provided by the page, as well as BitChute and Rumble, is just one example of doctors providing inaccurate information about COVID-19 and vaccines. The same issues that people are having with Joe Rogan, passing this fraudulent information out to people, to millions of people who basically are just saying, oh, if Joe says it, it's got to be true, because Joe wouldn't put a guy up there who would spread, information that's not true. Okay. So health agencies in North America and Europe assure that the shots are safe, though they say rare cases of blood clots have occurred in people who have received COVID-19 vaccines based on a different technology, not the messenger RNA shots. I'm still trying to accumulate more information, but on the ones I have so far, 62% of them have evidence of clotting, which means that these blood clots are not rare. It means that the majority of people are getting blood clots that they have no idea that they're even having, Hoffe says in the video. But experts told AFP, contrary to Hoffe's claims, elevated D-dimer levels alone are not proof of blood clots. A D-dimer test can be prescribed by a specialist when a blood clot is suspected, but a high D-dimer level in vaccinated patients would not necessarily be worrying. When you when you are vaccinated, there is often inflammation. You have a little fever, aches, pains. It proves that the vaccine's working or works. Marie Antoinette Sylvester Pietri, president of the French Society of Vascular Medicine, said on July 15th, an inflammatory reaction which results in an elevated D-dimer level, but this does not mean that thrombosis will occur. Dr. Nicholas Gendron, a physician in the hematology department of the Georges Pompidou Hospital in Paris, agreed. Having a high D-dimer level doesn't mean that you have thrombosis, which is the formation of blood clots in the heart or in a blood vessel, he said on July 20th. It means that additional examinations such as a CT scan will be necessary to confirm it, he added. The French Society of Hematology said on July 19th that D-dimer levels increase with age in pregnant women and in many pathological situations such as bacterial or viral infections, even benign ones. Okay, you can also find clots, and this is not on the article, but you can also find clots through ultrasounds. Do that all the time. You find the clots, and you also do imaging. So they're with all of those tests, it's triple verified. Okay, so you got labs, you got scans, CT, ultrasound. So that's usually how things are done. So, all right, unpublished, unverified. Experts contacted about Hoffe's claims emphasize that he did not describe the process he used to reach his conclusions and that his results have not been peer-reviewed. The experiment reported by Dr. Hoffe is not a scientific study and does not fall under the heading of evidence-based medicine. Therefore, no credit can be given to his results, the French Society of Hematology said. So when we say that studies are peer-reviewed, papers are peer-reviewed, the peer review process is to ensure that the information that you are given is factual. And it also allows other scientists to go and reproduce the results. Okay? That's very important. Okay, so Sylvester Pietri agreed, saying, "We don't know how he chose his sample among his patients. If he took 6 patients from his practice who are over 75 years old, they will necessarily have a high D-dimer level." She added that the scientific method used is not described and the results are not published. Contrary to the Canadian doctor's claims on June 2021, a study found that all of the participants who received the Pfizer-BioNTech COVID-19 vaccine, which uses messenger RNA technology like Moderna's, none developed symptomatic thrombotic events. During the study period, none of the parameters show clinically relevant variations at different time points before and after vaccination. Okay? Vaccines based on the viral vector technology, such as AstraZeneca's, have been linked to cases of blood clots, but these events remain rare. The technology used a modified version of a different harmless virus to deliver instructions to cells that enable them to fight the coronavirus. Okay? Use of the AstraZeneca and Johnson & Johnson vaccines was halted in some countries following reports of rare blood clots, but it has since resumed. The Canadian federal government has approved 4 vaccines so far, 1 each from Pfizer, BioNTech, and Moderna that use messenger RNA, messenger ribonucleic acid technology, and 2 from AstraZeneca and Johnson & Johnson, which are viral vector. More than 49 million doses of COVID-19 vaccines in total have been administered in Canada. Okay? So there you have it, ladies and gentlemen. Slick Rick was indeed in error when recommending that people look into this fruitcake of a doctor whose colleagues are basically shutting him down. Actually shut him down a long time ago, but we still have people sitting up talking about this dude. This medical professional, I guess, who doesn't respect the process of, scientific research and methods and whatnot. But that's neither here nor there. I pulled up another, fact check into him that was done by Reuters, and there it is. I'll let you guys read that. It has some additional information there. So we'll get down to the verdict here, and basically says false experts told Reuters that there is no evidence for messenger RNA vaccines being linked to blood clots and that methods used by Dr. Charles Hoffe are unreliable. This article was produced by Reuters fact check team. Read more about our fact check work here. So if you want to know how they came about doing this and what they did, how they proved, this article is full of links to get you there. But I can tell you what does cause blood clots. That leads me to my third source of information here, and that is from Medical News Today. What to know about COVID-19 and strokes, better known or AKA CVAs. All right. CVA stands for cerebrovascular accident. Okay. Research suggests an association between COVID-19 and stroke. There have been several reports in the media about potential links between stroke and COVID-19, especially in younger people. This article at the evidence to date and offers advice in the information on what to do if someone has symptoms of either COVID-19 or a stroke. Can COVID-19 cause a stroke? So far, research seems to indicate that COVID-19 may increase the risk of having thrombotic vascular event or thrombosis. Thrombosis occurs when a blood clot forms and blocks a blood vessel, such as a vein or an artery. Okay. Alrighty, blocking blood flow can cause several serious complications, including heart attack, when a blood clot blocks blood flow to the heart, stroke, when a blood clot blocks blood flow to the brain, transischemic attacks, mini strokes, when a blood clot temporarily blocks blood flow to the brain, critical limb ischemia, when a blood clot blocks the blood supply to a limb, pulmonary embolism, when a blood clot blocks the blood flow into the lungs. Okay. Each one of these events present in a different way. And, when you see it present, the presentation and certain things fall into line, you act accordingly. But that's a little deeper than we need to go here. So studies have found that people who have SARS-CoV-2, the virus that causes COVID-19, develop abnormal blood clotting as an inflammatory response to viruses. This increases the risk of blood clots forming. If a blood clot blocks an artery to the brain, it causes a stroke. As research continues, experts are discovering more about which people with COVID-19 are more likely to have a stroke, according to the UK Stroke Association. These include people with underlying health conditions that affect their heart and blood vessels, such as hypertension, diabetes, and heart disease, people with severe symptoms of COVID-19, people of Asian ethnicity, According to a 2020 article, people with COVID-19 are 7.6 times more likely to have a stroke than people with influenza. Another 2020 article, there are links here, the highlighted areas there, records that in the areas with a high concentration of people with COVID-19, hospitals and healthcare teams are reporting stable or increased incidences of stroke that appear to have no typical cause. Recent studies show that people with severe cases of COVID-19 are more likely to have a stroke compared with people who have milder symptoms. In a 2020 Wuhan study, linked also there, researchers found that almost 6% of the people with severe infections had neurological complications, including stroke, compared with less than 1% of the people with non-severe infections. Research also shows that stroke affects younger people with COVID-19. The separate studies from New York, Paris, and New York and Philadelphia show that people with COVID-19 who have a stroke are significantly younger than people without COVID-19 who have a stroke. By as much as 15 years. However, the UK Stroke Association points out that older people with COVID-19 are still much more likely to have a stroke than younger people with COVID-19. Okay. Stroke symptoms to look out for. According to the Centers for Disease Control and Prevention, these are the major signs and symptoms of stroke, all of which come on suddenly. Numbness or weakness in the face, arms, or legs, especially on one side of the body. Confusion, difficulty speaking or understanding speech. Difficulty seeing from one or both eyes. Dizziness, loss of balance, coordination, severe headache. Okay, act fast can help a person having a stroke get the treatment they need as soon as possible. People who are helping someone who may have a stroke should follow these instructions. F stands for face. Ask the person to smile and check if their face droops on one side. A is arms, stands for arms. Ask a person to raise their arms and check if one arm drifts downward. S stands for speech. Ask the person to repeat a simple phrase and listen for slurring or difficulty speaking. T stands for time. Save time and act quickly by contacting emergency services immediately. And that can't be stressed enough. The faster you get them to an emergency department, the better. The more time that passes, the more damage is done with regard to strokes. Okay, so if the symptoms disappear after a time, it remains important to seek medical advice to rule out a mini stroke. All right, now we've got symptoms of COVID-19. According to the CDC, the following symptoms may appear 2 to 14 days after exposure to COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. People with suspected COVID-19 infection should call their doctor or visit their state or local health department's website for information on testing. People who do not have a doctor should contact the nearest community health center or department. A person with the following symptoms should seek emergency medical attention: breathing difficulties, pain or pressure in the chest that does not go away, confusion, inability to wake or stay awake, pale, gray, or bluish skin to the lips, or nail beds, depending on skin tone. Note that health agencies and scientists around the world are continually revising symptoms of COVID-19 as research advances. People should stay abreast of updates. Okay. And this goes into a lot of things that I hear all the time, and that is, why is the goalpost moving with COVID-19? Why is there no consistency? Why are they constantly changing the information that they're giving to us at this time, and then tomorrow it's different? It's because They're constantly gathering data, and the information is being put out so fast due to the media, the internet, that in the past there was more time to try to gather the data and reveal what the data has indicated after review of the data. Well, that's not happening anymore. So there's this hunger for instant gratification with regard to whatever news we're dealing with. And unfortunately, science doesn't work that way. It never has. And the people who are listening to this don't have an understanding or an appreciation for how this should be done. But again, a person who took science in junior high school should know that how this works. But we've got grown people who have been through the education system that still don't know how science works and are out here, almost with pitchforks and torches, acting as if, people are out here spending their entire lives on finding ways to, to poison them, essentially, which is not the case. So, moving along here, how does COVID-19 affect stroke survivors? Experts have noted that all stroke survivors and people with neurological conditions such as dementia are more vulnerable to becoming seriously ill with COVID-19. This may increase risk of being hospitalized, needing care in the ICU, being intubated, or having mechanical ventilation. And lastly, death. Okay. And usually it's in that order. So, how does the COVID-19 pandemic affect treatment after stroke? The effects of the pandemic may mean that some people in the hospital for a stroke may leave earlier than usual. They may also have problems accessing care acutely during the stroke or after leaving the hospital. This may affect services such as rehabilitation resources, such as physiotherapy and neurohabilitation therapy. Okay. However, they should still get the support and treatment they need from their healthcare team or stroke center with a detailed care plan. Some treatments may need to happen at home, while appointments may happen over the phone or video calls. Stroke survivors are vulnerable to severe COVID-19. That means survivors and those who care for them should take extra precautions and care in maintaining hygiene and physical distancing, washing hands, cleaning surfaces, and items that others have touched is important. A stroke survivor may also wish to get a COVID-19 vaccine. Health experts also advise staying at home whenever possible. Stroke survivors may wish to ask family members or friends to undertake essential tasks outside the home, such as grocery shopping or pharmacy trips. They should also work from home where possible and avoid situations in which physical distancing is difficult to maintain. Wearing a mask to protect you and others around you. Stroke survivors should wear masks when venturing outdoors and avoid anyone not wearing one. Now, I know there's a lot of talk about, lifting mask mandates, and I think it's New Jersey or New York State, I think it is, that was saying that they're going to lift it in March, and they've dropped their infections by 70%. But if we've learned anything about this process, the very minute when we try to do things too fast, I would say, okay, if it was 90%, but I would still be reluctant at that. Could it be that the drops in the infection rate in New York State are due to people wearing masks and doing what they're supposed to do, and the vaccinations, ticking up? And once you stop the mask mandates in schools, with the young kids and whatnot, that it's going to tick back up, here in Arkansas. I mean, you've got people still wrestling over mask mandates, and people have pretty much not been wearing masks anyway. So, and they're we're just wing dinging it down here, and everybody's talking about how the infection rate is lower, but lower by what? They say lower than last September, or lower than 2021. Okay. Well, is it lower than, the beginning in 2020? Okay. What is it compared to what it was in 2020, at the same time? No, we're still 2-3 times higher than that. So, and the death rates are increasing, but the death rates usually trail behind infection rates. That's expected. So those are the things that we're seeing, that people are just, it's like we're itching to get back out and just start doing the same old thing. Well, this may be something that we just may have to continue to do. Maybe, it's different, it may be a little uncomfortable, but, that's better than being sick. I'm constantly hearing stories about people who basically just, I heard on Facebook that I shouldn't be doing this. I heard on, this on, Joe Rogan and on Fox and, all these other, news agencies that are, on the periphery, of where people, normally get information. They hear all these stories, and you hear people saying things like, well, why should I take the shot? I'm still going to get it. No one ever told you that if you get a vaccination that you wouldn't get it. They said it'll keep you from getting really sick from it. It'll keep you out of the ICU. Okay. But nobody remembers that because they didn't hear it, because they didn't get it in these alternative news, distribution networks, But let's move along. Okay. All right. Anyone who has symptoms of stroke should contact emergency services immediately. Hospitals have developed strict protocols and procedures to protect incoming people from COVID-19. All right. In summary, COVID-19 may increase the risk of stroke in certain groups. The presence of the pandemic may also increase the risk of complications and severe illness in stroke survivors, regardless of the cause of their stroke. Knowing the symptoms of COVID-19 and the symptoms of stroke will help people get the treatment they need faster. Individuals should never delay getting emergency medical care because of COVID-19. All right, I will put this in the description. And one last thing that I want to say about this is there are other conditions. If you don't know what, or have never heard of COVID tongue or what it looks like, look up COVID tongue. Look up COVID-19 and foot swelling, or COVID-19 and lower extremity swelling. Type it in like that and you'll see what you get. Look at the pictures. It happens, COVID-19 and lingering respiratory difficulty. It's happening. I know people that I'm working with right now, nurses who have been infected, who, after coming back to work, can barely walk up the hallway without stopping a couple of times to get where they got to go. So they're having difficulty working, more so than they did before they had it. If you can avoid this, trust me, respiratory difficulty is nothing like you have experienced. It's, if you've ever been really, really out of breath, imagine that, and not being able to breathe, in any way that's going to remedy that. Okay. They got to put you on oxygen. They got to help you out. And that's because of, the damage associated with the clotting and inflammatory processes induced by infection with COVID-19. So that being said, COVID-19 definitely does cause clots. Thank you, Slick Rick, for recommending that we look into this guy, this medical professional, this person who, would like for us to believe that he has found something new without doing what he's supposed to do. So, you guys let me know what you think, and, if you guys like what I'm doing, please support the channel. Please like, share, and subscribe. Don't be like Slick Rick. That's you, Slick Rick. That's you. Don't be like Slick Rick, running after logic and being left behind. You guys, I appreciate you. Love all you guys. I want everybody to be safe. Protect your families, protect your communities, protect yourself. And let's keep doing what we do.
You are listening to Abuki Cabal, the analytical savage.
You guys, appreciate you checking out my show, and have a good day. Until the next time.
I feel like a